Presiding Officer, next month it will be 3 years since the Scottish Hospitals inquiry was announced. And these are the facts we already know. Firstly, 2 children died because of infections they contracted at the Queen Elizabeth University Hospital. Secondly, there were serious failings at Greater Glasgow and Clyde Health Board, which resulted in the Health Board being put into special measures. Thirdly, Louise Lawrence, whose husband Andrew died after contracting aspergillus, was kept in the dark by a cover-up. Despite all of this, the Chair and the Chief Executive of the Health Board still have their jobs, and no one has been held responsible. Now, this week, the Health Board, under the same leadership, has shamefully refused to accept many of the conclusions of the Oversight Board, and they've even called into question the entire basis of the independent review that exposed fatal infections in clinically vulnerable children. So, First Minister, why should people who refuse to accept even the most basic facts be trusted to run Scotland's largest health board?
First Minister.
I say that Anas Sarwar has raised these issues rightly on many occasions, and of course there is, as he has already said in his question, there is already a public inquiry taking place in relation to a number of the issues that he has raised. I think it's important that we don't prejudice an inquiry that is taking place, and of course wait for the outcome fully in terms of that inquiry, and then of course appropriate action will be taken in respect to those issues. But of course it is important, and we have made it clear that we are not waiting for that inquiry to finish, where we can take remedial action, where we can take action to improve the situation, and across a number of areas that Anas Sarwar is right to raise in this chamber, that is being taken. And of course my understanding certainly is that a number of the Oversight Board recommendations have indeed not just been accepted, but work is well underway in relation to some of those recommendations. So it is important that these issues of course are raised here by members right across the chamber. My thoughts are with all of those families that have been impacted and have been affected by some of the challenges that the Health Board undoubtedly has faced. But I will continue, and I know the Health Secretary will continue, to engage with Greater Glasgow and Clyde Health Board to make sure that these recommendations of the Oversight Board are indeed taken forward.
Anas Sarwar.
I think the First Minister misses the point. It's that we are going backwards now, because the Health Board leadership are saying they do not accept many of the findings of the Oversight Board, and they now do not accept the findings of the independent case note review that highlighted these infections. And I think that's the point that the First Minister is missing, because as Health Secretary, Jean Freeman understood that grieving families needed justice. She listened to the voices of families and campaigners and put the Health Board into special measures, and she established the inquiry. But when Humza Yousaf took over, he was too weak and easily led, and he lifted the board out of special measures and empowered those people that failed. Now, less than a year later, the leadership of the board are trying to rubbish the independent review and questioning the accepted facts. Kimberly Darroch, whose daughter Millie Main died, says that the board is making the families' lives hell. And Louise Lawrence says this: "Enough is enough. Patients have been harmed, others lost their lives. Families lied to and bullied. For what? To protect the reputation of Scotland's flagship hospital and that of the Scottish Government." So, First Minister, will you allow the leadership of this Health Board to rewrite the facts and continue to prolong the agony for these families?
First Minister.
I won't. Of course, we will hold the Health Board leadership absolutely to account in relation to the oversight recommendations that have been made. And of course, the reason why the Greater Glasgow and Clyde were de-escalated in relation to special measures was because the majority of those oversight recommendations were accepted, work was underway, many of them also complete. And that's why decisions around de-escalation were made. In relation to patients and those that have suffered, and of course, Anas Sarwar again has raised cases of Millie Main, of course, of Andrew Lawrence. In that regard, I'm always happy, and the Cabinet Secretary for Health and Social Care would also be happy to meet with those families involved. But we have brought forward a number of measures to improve transparency and making sure that families do get the answers when, unfortunately, in those rare cases, things do go wrong, such as the duty of candour, for example. We introduced that organisational duty of candour in April 2018, places that legal duty on all health and social care organisations to be open, to be honest when something goes wrong. The Patient Safety Commissioner that we have committed to as well in terms of the legislation being introduced in response to that important Baroness Cumberledge report. And in terms of whistleblowing, we have made it clear, and I certainly made it clear when I was the Cabinet Secretary for Health and Social Care, that whistleblowing is an integral and important tool that should be used by staff in order to raise concerns where they feel it's necessary and where it's appropriate. And I met in my time as Cabinet Secretary for Health and Social Care every single whistleblowing champion right across health boards up and down the country, including the whistleblowing champion at Greater Glasgow and Clyde. So we'll do everything we can in our power. We'll hold, of course, the Health Board absolutely to account. In my conversations with the leadership of Greater Glasgow and Clyde, they certainly understood the seriousness of the issues here. What we'll make sure we do on behalf of the people of Scotland in government is make sure that when things do go wrong, in the rare times that they do, the vast majority of people will get a good service from our health service. And in the rare times when things do go wrong, we'll make sure that families get the answers that they deserve.
Anas Sarwar.
The First Minister has not held these people responsible to account. He's empowered those people that have failed these families. And frankly, staff at the hospital, patients that have been failed and families will listen to that answer from the First Minister with rage and think he's completely out of touch with the reality they face every single day. Because 6 years into this scandal, and the established facts are being denied by a health board leadership who are prepared to do anything to protect their own jobs. But this is what we've come to expect from this SNP government. No one ever takes responsibility, and failure is rewarded with promotion. The chair of the health board still in his job. The chief executive awarded an Excellence in Leadership award. The health secretary when the hospital was opened, and when Millie Mayne died, now the deputy first minister. And the health secretary who took the failing board out of special measures, now the First Minister. Under the SNP, failure is rewarded, incompetence is excused, and the Scottish people are left suffering the consequences. So, First Minister, if you are too weak to stand up for these grieving families fighting for justice, how can the people of Scotland trust you to stand up for them when it really matters?
First Minister.
Well, I think this is the point, is that Anas Sarwar can spin in any way he wishes to do so. But the people of Scotland, of course, have continued to trust the SNP with the health service time and time again. And why have they done that? They've done that because we've invested record amounts into our health service. They've done that, of course, because we steered this country through the biggest shock the NHS has ever faced in its 74-year existence. They've done that, of course, because our NHS staff are the best paid here than anywhere else in the UK. So we do value our staff. I seem to remember quite well doing a debate here when Anas Sarwar was leading a debate for the Labour Party on health, where, of course, staff at Greater Glasgow and Clyde, doctors and nurses, criticised the politicisation that Anas Sarwar was doing at the time in relation to, of course, the health service here in Scotland. So what I would say to Anas Sarwar is the decision to de-escalate Greater Glasgow and Clyde was made because of the evidence that we had in front of us. I'm happy for him to see that evidence once again and to provide him with detail once again. What we'll continue to do is make sure that, as I say, in the rare times that things do go wrong, we'll continue to make sure that we do everything in our power to make sure there's absolute transparency, that families get the answers that they want. And I am more than happy as First Minister to meet with the families that Anas Sarwar mentions that have undoubtedly been affected by where that failure has happened.